afternoon. My name is Jada Kirk, and I am going to be opening up my sterile instruments and going over them with you. I've been in sterile processing class since June of 2022. I graduate June 2023 of this year. If you do see me looking down and referencing, I have some notes here on the side and my phone to look at for things to go over. Now, this is the bag of 36 instruments that I received, and I'm going to be taking them out one by one and giving my thought process on them and saying exactly what they are. First thing that I have is the Yanktier suction tip. Looking at this instrument, it looks like it attaches to some other device, and suction, of course, makes me think that it is used to suction maybe blood because the holes in it are not particularly big, they're little. So I'm assuming that it suctions blood during surgery. My second one is the Russian tissue forceps. This to me, I think that this is used to help pull fat off of the skin when they're cutting open the skin to get into the inner core of your body. I think that they use this to help pull the fat and harder tissue that is blocking their way because it does have grooves in it. This is called the pole suction tip, and this one as well does attach, have another component that it attaches to, and this also has very small holes in it, so I think that this is used more for maybe to drain the blood out of organs because it has more holes in it, or maybe this is used for internal bleeding, for them to drain the blood out so that they can get a better observation of actually what's going on. This is a pretty large one. This is called the Denver Retractor. And I think the Denver Retractor this to me seems like this is used to help hold open a large incision or to help pull the skin or something out of the body, but something out of a large incision. This is called the Army Navy Retractor. This is smaller, but has the same similar shape as the Denver Retractor that we just looked at. This is maybe, I think, it's one piece, but it looks like it divides into two. So I'm assuming that they use this to hold maybe the chest open during a lung surgery or a heart surgery, something maybe to hold the chest open, break open the ribs, and it's positioned there so they can get inside past the ribs. This is the Bea Taylor tissue forceps. This is long, narrow, and it does have smaller grooves in it. So I think that they use this more for the beginning layers of breaking through the skin, not when they get deeper inside and break open past your durian. This is the Richardson 9.5 36 millimeter by 28 millimeter. This to me is very interesting. I can't even think of what this is actually used for. Nothing comes straight to mind when I do look at this instrument, but I'm sure along taking this course, I will find out more details about every one of these, and maybe my predictions are correct, and maybe they're incorrect. This is the Fraser section. So this has a looks like a piece of metal inside of a tube. The metal is small, thin, and has a point on it. I'm assuming that the point, I can't really tell if it has a suction on it, or if maybe they insert the point in it as such, or maybe that is what helps connect the section to something else. I grabbed 5 different instruments now, and this is the D. Baker tissue forceps. This is the dressing forceps. This is the tissue forceps. This is the Addison tissue forceps. And this is the Ferris Smith forceps. Of course, similar to the previous forceps that I've said, I believe that these are used in some form or fashion to help gather fat or hard tissue that has to be removed and not kept during the surgery. All of these except the dressing forceps. I do think the dressing forceps is exactly what it says. It is used for when you're dressing the patient up after surgery. This is the kosher forceps. These are larger. So I'm thinking that this is used to maybe um, hold tissue that is excessively bleeding to cut the blood supply from flowing out um, until they can stop the bleeding, or uh, I'm not quite sure. Um, this is the Rochester Carmalt forceps, and this one is pretty large. But I think that this is used for the same thing, maybe to hold some type of skin or artery or incision to stop the bleeding for the doctor.